going to keep admitting people here. Welcome, everyone. Thank you all for coming and for being here. I know more people are going to join us as we're going along, but I did want to get started. I wanted to thank our guests for being here to answer questions for us. So let me just go through a little bit of Zoom protocol. As I said, we're going to keep everybody muted. If you have a question to ask, there are two ways to do that. You can, if you open your chat box, I believe you have the ability to either raise your hand there, or if you like, you can actually ask, just type your question into the chat box. I'll be monitoring the chat box and asking questions. We're going to go till 8:30 tonight, and if we find that there's a desire and need for more follow-up, we will attempt to schedule another one. I'm very appreciative of our guests and the time that they're giving us. So let me just introduce them to you a little bit, and then I'll get started and with the first question, and then we can go on from there. So I don't know where everybody is on your screen, so I can only refer to where they are on my screen. We have Dr. Cara Natterson, over there she is, who is a pediatrician, consultant, speaker, New York Times bestselling author, most well known for the Care and Keeping of You series with more than 6 million copies in print, and a companion boy version, Guy Stuff. Her most recent book is Decoding Boys, a parenting book about why boys go quiet during puberty and how this quiet impacts their relationships with the people who raise them and the world around them. I needed that book, Cara, but too late now. Cara is the co-founder of Order of Magnitude, a company designed to hack puberty through healthy meets cool products. Most importantly, she's raising 2 teenagers who have a lot to say on the subject of puberty since they are living it, and she only does it for a living. Thank you. Dr. David Cutler is a family physician who has been practicing in Santa Monica for 32 years. He grew up in Boston, had his bar mitzvah at Temple Shalom in Newton, which I know well. Dr. Cutler graduated from Dartmouth College, attended Tufts Medical School, and completed his residency in family medicine at UCLA. Since 1988, he has been part of the Santa Monica Family Physicians Medical Group, serving as well on the medical staff of Santa Monica, UCLA, and St. John's Hospital. For the past 10 years, he's been the chairman of the Education Committee at Providence St. John's Health Center. Dr. Cutler currently volunteers for the USC Medical School, faculty teaching medical students and physician assistance programs. During this COVID-19 pandemic, he's been part of a bi-weekly virtual town hall devoted to educating, supporting, and engaging the primary care physicians of the Santa Monica community, bringing together clinical specialists from St. John's and researchers from the RAND Corporation to share ideas and learn how to treat this novel disease. And in his spare time, which I can't believe you have, David, he travels to Haiti, not now, to support a rural clinic and school there. Dr. Dana Hunnes, PhD, MPH, RD, which stands for?
Well, it's a PhD in public health, master's in public health, and then RD stands for registered dietitian.
Dietitian, okay.
Yeah.
At the Ronald Reagan UCLA Medical School for the past 15 years, an adjunct professor at the UCLA Fielding School of Public Health. And Dr. Nina Shapiro is professor of head and neck surgery at UCLA and director of pediatric ear, nose, and throat at Mattel Children's UCLA, where she has been in practice for over 2 decades. She tries to be a voice of reason when it comes to overwhelming amounts of health information coming at us minute by minute. That'll be good tonight. She likes to bash health hype whenever she can. She has 2 children, ages 12 and 16. Her husband, Elliot, is a head and neck cancer surgeon and professor also at UCLA. So welcome to all four of you.
You muted yourself, Rabbi.
Sorry, I was
And
trying
David
to admit somebody to the meeting, and I muted myself instead.
and
So
both Davids are muted.
thank you. All right, is everybody? Let me unmute David Cutler there, and I think I got everybody. Dana's unmuted. So I was talking with Nina just before it began. I was watching the news, as probably many of you have been. You know, hearing things like, I heard an epidemiologist talking about how we're going to have to do social distancing to 2022, and hearing about universities that are going to, may not start admitting or opening up their campuses till 2021, till the fall of 2021. And I think Nina was mentioning BYU not doing that.
BU, actually, Boston University. Yeah, maybe.
January.
Yeah.
So maybe we could just begin by sort of addressing some of the, what's the latest? Maybe you can share with us sort of what the latest, where's the best place to get news, you know, because there's so much coming at us from so many directions. We don't know what, for me, I'm sort of like lost in all of it. Like, what do I listen to? Where should I listen? Should I not be listening? Is it too much? I'll just kind of throw that out there and let.
Okay, well, I'll address it first, because I think there is definitely too much information out there, and it's very difficult even for medical professionals to filter all that information and decide which is really important and which in fact is accurate and which they're going to incorporate into their practices. And I'll generally recommend to patients they actually stop watching cable news, because they're getting information overload. And if they have particular questions, I'll try to counsel them or send them to the CDC website or the LA County Department of Public Health website and end their information input at that point. Because again, they can just get overwhelmed by the information that's coming out there and the various sort of social and political overtones that come with it.
Yeah, I think that's a great idea. I think that, you know, I talk to my parents pretty frequently back on the East Coast, and, you know, and there are people who are usually out and about, but obviously because they're home, the TV is on all day. And, you know, it's really, I think, unhealthy to just listen to the minute-to-minute news, because it's really not going to change anything. You're not going to miss anything if you miss a news feed, or, you know, even, you know, the fact that one college may extend their remote learning for another few months is not really going to change what you're going to do that day. It's just going to make you more upset and more anxious. So I think, you know, if you can listen to, you know, one bit of news, whatever that is, once a day, that's enough. You're not going to miss anything. We all know what we need to do. And, you know, but it's overwhelming and it's exhausting. I think most people who say they pull back a little bit from all the news feeds, they feel much better.
And I think there are some written news feeds that if you're a person who likes to read your content instead of watch it, that might feel more comfortable. There are some really great resources out there that send daily digests. So Axios has a really great coronavirus daily digest. The Wall Street Journal has an excellent one. You know, that you can pick the one you like, and there are links to articles if you're interested. But I find those very helpful because they're curated reads.
And then another organization that I like, probably because of my public health background, is the World Health Organization. And I just find that a lot of what they are proponents of is usually science-based and just pretty apolitical, because they're not really affiliated specifically with any one country or any political party. So that's something I like to go to. And also I found a British doctor who has a really wonderful YouTube podcast, and I can actually send that to you, Rabbi, later if you are interested. But he kind of goes over the basic science of immunity and gives really wonderful daily reports on the COVID-19, and it's just very factual based, very scientifically based, and I find him very informative. Oh, you're muted again.
Keep muting myself. Again, I'm going to invite people, if they have questions, to put them in the chat box. Let me ask a question about face masks, which Fern I think is asking, which is, you know, people walking around neighborhoods, do we need face masks all the time? Or if we're walking around our neighborhoods, do we need to have a face mask on? And or is it just going to the store? And when is the appropriate time to be wearing those face masks?
Okay, I'm going to talk about that first, and because everybody has feelings about face masks. So the science on face masks is very thin. It hasn't been studied very well, and I'll mention one good study that was done in China a few years ago. But my feeling is that there are two issues involved in face masks. One are the medical reasons to wear face masks, and the other are the social reasons to wear face masks. Now, the medical reasons to wear face masks are probably limited to high-risk situations that medical personnel face, or first responders, where you're going to be up close to somebody for an extended period of time. And in those situations, you don't want that person who might be ill coughing on you, so they need to be wearing a face mask. And if you're in an intensive care unit or a nurse working in an emergency room where there's high concentration of coronavirus there, you probably need, or you're a doctor, say, doing procedures like Dr. Shapiro does, you need to wear a fitted N95 mask to absolutely reduce to the lowest possible risk possible of having those germs enter your nose. But for the general population, it's very hard to prove a benefit of wearing a face mask, walking down the street or going into a grocery store. So the study I'm referring to was done in China, where they took about 1,200 people and they split them up into 3 groups. And one group wore the type of surgical face mask that you see a lot of people wearing now, where they have a cloth over their nose and mouth and straps around their ears. And a second group wore just a piece of cloth, like a handkerchief or a scarf over their face. And the third group wore nothing. And they followed them for several weeks, and they found it was during the flu season, and they tabulated how many colds and flus these people got. And they also examined the masks they had and looked at the moisture content and how many viruses were in them. The bottom line at the end of the study was the people wearing the surgical masks were in fact protected from viral infections to some extent by wearing those masks. The second highest group of infection was in the people who wore nothing, and the highest group of infection was in those who wore cloth masks, just a scarf or a handkerchief. And in examining those pieces of cloth, because they weren't specially treated, they had very high levels of viruses within the cloth and very high levels of moisture sustaining those viruses in the cloth. So to believe that they're protecting you medically is really hard to justify based on the science. But we do know that people who are sick will spew fewer germs out into the air if they have those masks on. So medically, somebody who's sick probably is helping the people around them, but not if those people are staying at least 6 feet away. That's the medical part of it. The social part of it is, if you're healthy and you go out in society and you know that everybody who's sick is wearing a mask, you're going to feel much less put upon and encumbered to wear a mask yourself. And so by going out there and having everybody wear a mask, it's much more likely that those people who are sick are also going to wear a mask, and they'll protect you. In other words, it sends the message to everyone, I care about you. I care about the other people in society, and that's why I'm going to wear a mask. And especially with coronavirus, that's important because we think that somewhere between 25 and 40% of the people who are infected have no symptoms whatsoever. They could be spewing those germs, and they don't know it because they feel fine. So I think wearing masks for social reasons has some benefit. Wearing it for medical reasons probably should be restricted to those medical settings where you're at highest risk.
Dr. Cutler, does the 6-foot distance make a difference in whether one does that or not?
Well,
Go Go ahead, Dr. Shapiro.
Yeah, I would just say that, I think it, as you were saying, and surgeons have looked at all sorts of protective wear over the years, including hats and masks and gowns and gloves, and what's really protective and what's really just culturally appropriate. But, my concern about any kind of mask, whether it's an N95 or a surgical mask or any kind of cloth mask, is that, and I've seen this when I've been out, is that you'll see two people who are clearly not living under the same roof, and they'll say, well, we'll go for a walk together and we'll stay 6 feet apart. And as they're getting, and if they have masks on, they can't see each other, and they can't, and you don't realize how much people are reading lips. And then all of a sudden you're walking and you become like this. And well, we have masks on, but so it's okay. And that's one of my big concerns about masks, is it's a little bit of a, as David said, they're helpful, but they're not really the be all end all for protection from this virus. Certainly is that it's going to give a little bit of a false sense of security, just as the gloves are in the stores, that's really your protection. You're protecting yourself and you're protecting others, when the reality is that the physical distance is much more valuable than a mask or gloves, for that matter.
The other piece of it is how you take them off, which is really significant, because if you are wearing a mask and then you take it off by grabbing it with your hand and pulling it off your face, a lot of the virus that's on the outside of that mask is now on your hand. You really have to think about then what your risk of infecting yourself is when you take that same hand and instead of washing it for 20 seconds, you touch your eyes or touch your mouth. Masks are great in terms of keeping our hands out of our mouths and off of our noses. We know it's a good physical reminder to keep our hands away, but as soon as it's gone, usually our hands go right back there. So if you do mask, and I think everyone should be masking for this social reason, which is this sort of social responsibility of I protect you, you protect me. I think it's really, really important piece to it. But when you come home, you take it off from the sides or very carefully. Masks that are made of cloth, they should be washed. They should not be reused and reused and reused without being washed. Disposable masks should, in theory, either be disinfected or thrown away. It's hard. There's a limited supply now, so a lot of people are saving them. But and then go wash your hands. And gloves should not be reused. Single-use disposable gloves should not be reused, because when you take them off, it's the same issue.
Great, thank you. Giselle asked about antibody testing, and we've heard a lot of this, people who are thinking that they've maybe already had it, but just were never tested, or was before it really became prevalent, and but they had this terrible illness and wondering if they had it. So is antibody testing, what about testing in general, but antibody testing, and is there a time limit on that antibody testing? And
yeah, let's talk about testing in general, because this is an area that is complicated and very controversial. So the standard tests that people have been getting up until now are the genetic or PCR tests that look for the genetic material of the coronavirus usually in your nose, sometimes in your throat, where they'll take a swab, and usually the answer will come back in a few days of whether or not they find it. The reason that that's controversial is that it's not very accurate, that most of the studies from China, where they take 100 known coronavirus patients and test them in that way, only 60% of them will test positive. So we know we're missing a lot of coronavirus patients by doing those genetic PCR nasal swab tests. Still, they're probably the most accurate tests we have, because when they're positive, they definitely show the coronavirus is there. The antibody tests are controversial for many other reasons. They involve usually looking for two different types of immunity, the IgM antibody immunity and the IgG antibody immunity. The IgM tends to come on early, and people believe it's an indicator of acute infection. The IgG antibody comes on a little bit later and lasts longer, and that's generally believed to confer longer-term immunity. But we don't know that because the virus hasn't been around long enough to prove that people who have these IgG antibodies actually are protected. And we know from studies in China that many people who had the infection never develop IgG antibodies. So what do you really know when you have these antibody tests? You really don't know anything. You may believe that if you have the IgM antibody that you have an acute infection, but it really needs to be confirmed with a PCR test. And you may believe if you have IgG antibody that you are immune to the infection, but we do not know that, and you should probably have some sort of more precise quantitative level of your antibody checked to see if you become a candidate for donating your plasma, to donate those antibodies in your blood to someone who's very ill, because that has now been approved by the FDA as a treatment for people who have severe coronavirus disease. So testing is both a complex and a controversial area right now. And we don't have all the answers, and we probably won't for quite some time, many months, maybe even years.
So I'll just add to that, there was a really interesting study out today that looked at several hundred patients in China who were coronavirus positive, nasal swabs. They were hospitalized. They all survived, but they were documented more than once to have coronavirus. And 10% of those patients never developed any antibodies by antibody testing, which again, we don't know what that means because of course they had antibodies, they survived the infection, but by whatever the antibody test method that was used for them did not pick up the antibodies that they had. So there are currently, I believe, there is one FDA approved antibody test. There are either 59 or 60 that are pending approval right now. And what's holding it up is exactly what David said, which is being able to understand what they're measuring. What's that outcome and what does the number even mean?
I think Fern had a question before. Fern, did that get answered?
Fern, did your question get answered?
She was nodding.
Okay.
She's mute.
Lisa asked about whether KN95 masks offer as much protection as N95 masks.
Nina, do you want to take that or should I take that?
Yeah, I mean, the question is why would you be wanting one? I think that, if you're exposed to somebody who's sick in your home, we talk about the N95s should be reserved obviously for people on the front lines working with patients. And the KN95, I think it's, whether it's as good or not, I know they're being donated and offered more readily than the N95s, but again, it goes back to why would somebody who's not taking care of patients want an N95? And I think the only good reason for that would be if someone in your home is sick with COVID. And, we always recommend that if that's the case, that they should be self-quarantined as much as possible. And, that obviously depends on your physical home situation. But that would be the only reason to wear a mask like this would be, really for that direct exposure. I think, again, it goes back to N95s are very tricky to put on correctly. We had to take a class and retake a class and watch these webinars and do practice sessions. And we're surgeons on how to put these on and how to take them off correctly. And it's not easy to do it right. And it actually can spread, as Cara was saying, it spreads the virus much more readily than you would know. And these are harder than those cloth masks to put on and off. So I get a little concerned when people want to try these new masks, not necessarily for
Yeah, I actually was asking just as far as professionals trying to get procurement, because I'm just helping with donations and with small group of us that are trying to help donate to the hospital for UCLA.
Yeah, I think that's great. And I think that a lot of hospitals are taking whatever, you know, if N95s are not available and not accessible, then I think they, you know, it really depends on the institution. Because I've gotten a lot of questions about UCLA, friends of mine wanting to donate, and it turns out that they have a whole specific method of getting the masks. They won't just take any certain mask. It's very specific. But I think a lot of, you know, certainly a lot of doctors' offices and a lot of health facilities are taking the KN95s if the N95s aren't available.
Yeah, let me just, I agree with everything Nina said.
I have a question.
Those things.
Hang on one sec, Joel. Hang on one second, Joel. David, did you finish? I'm sorry.
No, I just wanted to expand on what Nina was saying, because N95 is a very complicated area. You could write books about N95 masks. That just the terminology N95 indicates that they're supposed to filter out 95% of certain particulate matter to prevent it from being breathed into your nose or your mouth. But for them to achieve that effectiveness, they have to be fitted to you. And usually the hospitals will conduct clinics on their employees where they'll put a hood over their head and the N95 mask on the employee, find the right size, and make sure when they put a vapor inside the hood, which can be smelled, that the employee cannot smell it. So you get the tight fit there. And if they can't fit them, then that person cannot be certified as being qualified for wearing an N95 type mask. The KN95 terminology is the Chinese version of N95, so they're supposed to meet the same qualifications. But what has been found in many instances is that these masks, which come with the label KN95 from China, actually don't meet US specifications for being of N95 quality. And if you want to make sure a mask is of N95 quality, it'll have to have the NIOSH certification stamped on it, which many do not. So the hospitals are in a position of liability if somebody comes to one of their employees and they've given them one of these KN95 or N95 masks, which does not have the NIOSH certification. So it's not a trivial issue for the hospitals. And it's probably, as Dr. Shapiro was saying, something that even routine people outside the hospital setting shouldn't even be considering using, unless they're in a very high risk situation, and really unless they've been properly fitted for that N95 mask.
Thank you. Let me ask the second half of Lisa's question as well, which I think is something, and I invite others to please type their questions in to the chat box. But so Lisa asked, which I think is a question many of us have, is it safer for us to go shopping ourselves, or is it better to have someone go shopping, you know, have somebody shopping for us? What's less risky?
Yeah, I'll start taking this one, and if others want to chime in, that's as well.
Thank you.
But I mean, since at least everything I've been reading research-wise has basically shown, you know, if you can avoid being in packed places, including grocery stores, that's obviously healthier and better and safer for you, especially if you are, you know, do have pre-existing conditions, asthma, heart disease, any kind of comorbidity. For sure, you know, getting delivery is most likely going to be safer for you. With that said, you know, there are concerns that the virus can live on packaging, particularly plastic packaging. I've read reports it can live on the packaging for up to 3 days, also on metal, and on more of the like wood fiber packaging, cardboard, you know, can live on that for 24 hours. So they do recommend, if you are going to be getting deliveries of foods, you know, if it's not perishable, if you have a place where you can just leave it for a few days, let the virus mostly die off, that would be safer. If it is perishable, it's recommended, if it's like a hard surface container, to clean the outside of it with sanitizing wipes. Obviously, you don't want to use that on the foods themselves, particularly if it's something with an edible skin you're going to be consuming. But you know, that would be the recommendation. If you can avoid going to stores, that is better, particularly because, you know, you're going to have more exposure to aerosolized virus at that point.
Anybody else on that? Joel, I just unmuted you. Go ahead, Joel.
Well, I have my mother gave me this mask. It's got like a plastic shield on it, and it goes for your eyes and protects your eyes. Is that good or not?
Can you hold it up again?
Okay.
I can't quite see it. Hold it a little higher.
It has like a plastic shield
yeah.
for your eyes.
Yeah, yeah.
Sure.
I wonder if that's better than anything else.
I can answer that. So it's those kind of masks are actually what, it's a surgical mask with a shield on top. And I think that will be just as effective as a surgical mask. I mean, you have glasses, so that's somewhat of a protector there. I think, if you're going out in public, the only concern about a shield like that, you probably wouldn't want to drive with that. I see people driving with masks. I wouldn't have that plastic shield on if you're driving a car. If somebody coughs right in your face, it's going to protect your eyes a little bit more. But again, hopefully they'll be at least 6 to now, let's say 10 or 12 feet away, that, they won't be coughing directly in your face. We wear those in the operating room in the good old days when it was just regular secretions to protect our eyes. But again, it's really just, it's going to give you a little extra barrier, but some of those shields are a little difficult for your line of vision if you're walking around or driving. Don't drive with that. Don't ride a motorcycle with it either. You're muted.
Yeah, so you're saying I should not walk around too much with it?
Well, I mean,
get fogged up?
If you're going to the grocery store and you're wearing that as opposed to just a cloth mask, it's not going to be too different. If that's the mask you have, it's certainly fine. But you don't want to, you don't want to rely on that too much as your sole barrier. Still want to make sure you're at least 6-10 feet away from people.
Yeah, I just want to echo what Nina just said, is that there are two things that everybody has to do all the time, and there are maybe 100 other things that you might want to do some of the time. The two things that you absolutely have to do all the time is stay 6 feet away from other people and wash your hands before you touch your face. And if you do those two things, you'll probably never get the coronavirus disease. But if you want to do other things like wear masks or gloves or face shields or do antibody testing and vitamin supplements and things like that, they may or may not be helpful. But again, the things you have to do are stay 6 feet away from people and wash your hands.
I just want to add one thing, actually. There is some literature out there that demonstrates that vitamin D supplementation, especially if you are deficient, can actually help with immunity. So particularly with respiratory ailments. So that might be, I'm not suggesting everyone blanketly take a vitamin D supplement, because if you're already within normal limits, taking vitamin D too much could be not healthy. But if you are deficient and you have a deficiency, it might be worth talking to your doctor or getting a supplement if you're deficient.
Thank you. Anne, go ahead.
Yeah, my question is really going back to you, David, and anybody else who wants to chime in on this. And it had to do, I see somebody else asked another question about antibody testing, but one of the things that you said, I thought, was that if there's an antibody test that is taken, it should really be confirmed and sort of seconded by another test. Was that the swab test that you were suggesting should go in parallel?
So it depends what you're looking for. If you're looking for acute infection and your antibody test shows IgM positive, then yes, you'd want to do the nasal swab to see if the virus is actually there. Mm-hmm. If you do the antibody test and your IgG is positive, suggesting immunity, then you may want to do a quantitative immunoglobulin level to see what the level of that antibody is. But even if you have a high level, we don't know that that actually confers immunity.
Right.
And the complex thing here is that your body has two large systems providing immunity. There's the part of your system that provides antibodies like IgM and IgG, which are tested for. And there's the part of your immune system that activates cells, the T cells that we've heard about during AIDS that get destroyed that way, that may be the actually more important part of providing long-term immunity for people after coronavirus infection. We don't know this. It's called the novel coronavirus for a reason. It's new, and there's just a lot of stuff about it we don't know. But just measuring antibodies does not give you a full picture of your body's immune response to the coronavirus infection.
Yeah, I asked the question with in relation to your talking about donating plasma or being able to be a support person to other people. Thus my inquiry.
Right, so I'll comment on that, is that was just recently FDA approved as a treatment for people with severe coronavirus disease, as giving them the plasma from recovering patients with coronavirus. And the Red Cross, and I think UCLA, and Nina may know about this, and others may know about this, is offering programs to collect the blood from people who have recovered from coronavirus infection, look at its level of antibodies to administer it to people who are acutely ill.
Thank you.
Fern, do you want to ask your question about the pool?
I had a question and Joe had a question. I'm just wondering, you know, we've been self-isolating, staying away from our grandkids. I wonder if we could have them at this point come over, swim in our pool, we stay away, and if they're safe, and then once they do that, if we wanted to go in, are we safe?
Of course, the pool is chlorinated.
Yeah.
I'll take that one. You know, there's been a little bit of research looking at chlorine killing the virus. We know chlorine kills most infections, but I would probably not suggest that you do it because we don't know a whole lot about how this virus behaves. And it feels to me like an unnecessary risk. So if they wanted to come over, enter through, not through the house, but through a side access and use the pool, and the pool became theirs to use, I personally probably wouldn't then have you get in the pool. It's not that there's science that shows it's a problem. It's just that it hasn't really been studied, and it feels like an unnecessary risk to take.
Yeah. What's the thinking on zinc supplements as a prophylaxis against this virus?
There's really no data on any vitamin or nutritional supplement being protective against getting coronavirus. And there are early studies that are starting to come out, and there is a lot written about vitamin D and a lot of people looking closely. But so far, you know, anything that you may have read that suggests that you should buy a certain supplement like zinc is not based in data that I'm guessing Nina, David, Dana are really invested in following. So I would not use a supplement and feel protected.
And the other thing with zinc is if you take it chronically, it can interfere with copper absorption. So that would be another reason to not just blindly taking zinc to help your immunity, because, you know, we all need copper as well. And it's not easy to get blood tests at the moment.
And one more thing about zinc is that it can cause anosmia, which is a sign of coronavirus, which is, you know, loss of sense of smell. When they were, you know, Zicam, many of you remember, the cold medication, which was zinc-based, was pulled because it was causing anosmia. And you don't want to confuse your anosmia from a zinc supplement from having coronavirus. So, and plus it's a very disruptive problem to have. So I agree. I mean, if you take a multivitamin, that's fine. And if you take, you know, low dose other vitamins that you've always been taking for your whole life, and you enjoy those and your doctor says it's fine, then that's fine. But I certainly, now's not the time to start adding anything that you don't do normally, except, you know, being healthy and having a, you know, good balanced diet. But I wouldn't start adding anything that you're not used to taking.
Yeah, I was just going to add that, and you mentioned it, having an extremely well-balanced diet with, lots of fresh produce, cook it if you're concerned, but having a lot of produce in your diet right now, and just trying to stay as clean eating as possible is also going to be very helpful for your immunity just in general and your overall well-being.
Question related to that, about food, home deliveries like takeout and things like that. What are your thoughts about takeout and yes,
Yeah.
no?
Again, according to the FDA website, USDA, other sites and articles I've been reading, they don't really show that there's a danger of getting it from the food itself. It would really be the packaging that would be of concern, in which case, again, if it's like a hard packaging, it's recommended to wipe it down, wash your hands, be very clean with your hands, reheat the food to ensure that, any potential pathogens might be killed, recommended in the oven or on the stove. But as far as getting the food taken out, the food itself is not of concern, but the packaging might be.
Okay.
We get a lot of delivery. I'm not a good cook. It's that or we starve.
Okay.
But I'll tell you what we do when we get the food. And again, gloves or no gloves, what's important is keeping your hands clean and not touching them on your face. As David said, if you don't touch your face with your hands and your hands are clean, you're not going to get coronavirus. It doesn't just it's really not miasma of the 1600s. It's not like floating in the air that literally. But what we do when we get the food is we take it, we don't eat it, which is kind of nice to do anyway. We don't eat it in the packaging that it arrived in. We put it in our plates. We haven't been getting delivery of any sort of salads or cold food. It's only hot food. And then we do, reheat it or microwave it, however you want to reheat it before we eat it. And we wash our hands like 15 times during that whole process. So again, it's not a gastrointestinal, infection. So it's not transmitted if you eat something. But we do get delivery. And actually most of the delivery folks now, it's kind of understood that you don't open the door, which is very strange. But they just leave it and you get a text or a knock on the door, and then, you wait until they get to their car and then you reopen the door. And so it works out nicely. It's good to support the local restaurants.
Yeah.
So we should take out when we can.
Thank you. Thank you.
Yeah. Hello. Hey. Yeah, I've been reading and of course hearing, and I think David mentioned antibody transfer through plasma transfusions. Is the hope that there's going to be these antibodies are going to be synthetically produced in order to create some herd immunity? Anybody want to take
the hope is that there'll be a vaccine. I'm not a scientist and I'm not a researcher, and I'm not going to compare coronavirus to the flu, but the way we were able to control flu epidemics is by immunizing people against influenza. Now, these vaccines were never 100% effective. In fact, at best, they're probably only about 50% effective. But if we could have a vaccine that was at least 50% effective against coronavirus, that would be a huge advance.
You can address the whole vaccine. We hear about hydrochloroquine and zinc together, and I just read something the other day about an anti-parasitic medicine, I think out of India or someplace, and then somebody asked about the question about whether Israel might be close to creating a vaccine. What's the whole story about?
Well, yeah, those are good questions, because that's really where we're headed eventually. And I think you have to separate the preventive therapies, like a vaccine, from the treatments, because giving somebody a medication when they're ill you can justify imposing some risks on them. But if you're giving something to everybody when they're well, it better be pretty darn safe before you administer it. And taking the risk that you might actually make them sick or kill them. So it takes a lot longer to research and then justify the administration of a vaccine than it does to, say, give them chloroquine or hydroxychloroquine or even vitamin D or zinc in the hopes that you might prevent that infection or treat a mild infection. But even now they're finding that with hydroxychloroquine and chloroquine, these are anti-malarial drugs, that there were some reports, and these aren't scientific studies, these are just reports, that people got better. There are probably an equal number of reports where people didn't get better. And now we're finding that the number of complications from chloroquine, the standard anti-malarial drug, is causing significant heart complications. And my understanding is they've stopped using that completely. So it's really premature to recommend any of these medications on a routine basis. And as far as I know, in most medical situations, they're only being used on the sicker patients who've been hospitalized and not on those who have mild disease or as a preventative, any of those medications.
Anybody else on okay. So just looking, Fern, did you have another, your hand is raised again. Was that for another question? Or I saw, Ann, I see yours, and I wanted to ask Cindy's question as well. But can I go ahead with a couple of the questions? Okay, so let me ask Cindy's real quick, which I think is a great question, because I know I've seen this from the Red Cross, that there is a great shortage of blood and the need for blood donations. What's the best way, where can that be done, and what's the best way to go about doing that if people want to donate blood?
I think UCLA is still having, I think they're still open for donations.
Yeah, my husband donated just the other day.
At UCLA, right? Yeah,
Correct.
I think so. They may, I mean, because it's usually like right outside the 200 Plaza. So, you know, I don't think it's concerned.
Well, I think they're requiring appointments first, and then you go down to the B level, and it's a whole setup.
Are they COVID testing before donations? Probably.
Oh,
yeah.
Yeah, it's a way to get a COVID test.
There you go.
Okay, great. Ann, do you want to unmute yourself and ask your question?
Yeah, mine is just really for you to talk a little bit about, I'm going to cough, what doctors are feeling, how they're dealing with this. I'm particularly concerned about what's going on when they have to face these life and death situations in the ICUs. When they have to talk to families, or they have to talk to the patients. It's extraordinarily moving, and I wonder what you're hearing from the medical community about how they're coping. And now I'll cough with the mute on.
Well, I mean, I have a lot of friends who are, you know, working pretty closely with COVID patients, not myself. And, you know, it's as bad as it seems. It's as bad as you see. You know, oftentimes, you know, news is sensationalized. This is not sensationalized. It's much worse than what we see, because we only see, you know, one little story or you know, a little, you know, news clip or you know, an article in paper featuring one thing. But, you know, the expanse of this, I have lots of friends in New York City, is, you know, beyond belief. It's worse than it seems. And, you know, the stories you hear about people dying alone, you know, are true. It's horrible. It's, you know, as physicians, you know, we took an oath and we're doing what we love to do, and it's important. And, you know, I think if you ask any physician, they would never do it otherwise. But, you know, thankfully, at least on a lot of the social media, because it's all social media now, you know, there's a lot of, you know, support in the medical community for each other. And one of the, you know, very thin but strong silver linings is that I think physicians from one specialty to the other have sort of a new level of respect for each other. And, you know, I think for nurses and respiratory therapists and, you know, certainly, you know, anyone who works in an emergency room or an ICU or an OR, you know, we have a, you know, sort of deeper connection and respect for each other. So, you know, I think in the end, that'll be the good thing, but currently it's awful.
I think addressing the emotional and spiritual impact of this disease is going to be very important going forward, because even though the incidence seems to be flattening now, this is something that's going to go on for a long, long time. And both its impact on the medical professionals who are dealing with these number of deaths, but I just think that with the families and the individuals who are suffering, the statistics for people when they get in the ICU and on a ventilator is that most of them will not survive. And the rules in just about every hospital that I know of is that you cannot have any visitors there. And for any of us who've had family members in an acute care situation or patients in that situation, the one thing that gives them the most comfort is just having somebody there and feeling that someone cares about them and someone's holding their hand and that they're loved and that there's someone there to support them. And in most situations, there is no one there to support them. And you can understand why, although the nurse's obligation is to be there, the nurses do not want to be in those rooms with their ventilators any more than they have to be. And the patients they're dying alone, and most of them who are on ventilators are dying.
Yeah, Mitch, go ahead.
So just as a follow-up on that comment, both Nina and David's comment, and I don't know that this is a question for them as much as it is a question for the 30-odd people on this call, and certainly one that I don't know that we'll answer tonight. But when you speak about the emotional and then spiritual impact of this treatment, as a community of faith and one that looks to support our immediate community, I think it raises a great question as to whether or not there's a role to be played for University Synagogue and its congregants and its clergy as a vehicle of faith and support. And again, not an answer for this call necessarily, but I think an interesting rhetorical question as we think about how we interact with the community and how we can best support.
I don't have an answer to that specifically, but I do think it brings up sort of a more general sadness and malaise in the community as a whole, as we've all been somewhat isolated for a month. And any of us who have kids have watched their lives grind to a screeching halt, and it's been very, very hard for them. In many ways, they have us much more available to them than ever before. And in many ways, they are seeing pain and sadness and suffering, both on the news and in the world around them. And also, frankly, just feeling it because they are not physically connecting with people around them. The way my 16-year-old describes it, and I think it's probably the most articulate way of describing it, is it's hard to talk to people because there's nothing to talk about, because there's nothing new happening. So what are you going to talk about? And I think that's a very teenager way of articulating something that we all feel. So I think even outside of the scope of what's happening in the hospitals, which, I mean, I agree with Nina and David, is, the description is devastating all around and real. But outside of that is the very large, broad, subtle sadness that we're all feeling. And when these articles come out suggesting that because we're doing such a good job of flattening the curve, we probably have to do this a lot longer, it just takes the wind out of a lot of our sails, and it's hard. So I think it's nice to even bring it up to begin to acknowledge it.
Yeah. And I have a 6-year-old at home, and I mean, a little bit different from a 16-year-old, but I mean, same thing, I'm home with him in the mornings, go to work at UCLA in the afternoons. So, that has its own inherent challenges, but we do, I think, sometimes forget that my 6-year-old was out running around playing with his friends for 4 hours when school ended at the end of the day. And now he's, he goes out for an hour in the morning for a walk or an hour in the evening for a walk. And other than that, it's, maybe he gets to Zoom with his friends for a few minutes with the entire class. So absolutely, that's definitely changed. And my experience working in the hospital is a lot of nurses are extremely anxious. I think doctors are as well. Like, I don't want to speak for them because I actually deal much more with nurses as a dietitian, but I know my own experience. you know, just on a weekend recently when I was the only dietitian in the entire hospital and had multiple consults on patients with COVID-19, you know, I don't go in the rooms, but I know the nurses who do get very anxious. And here we've been very lucky, not that many. So I don't know if everyone's just holding bated breath or kind of praising, you know, how few patients we've had at the moment. But I think everyone, it's definitely a new world at the moment for a lot of different people for a lot of different reasons.
David, did any of you wanted to respond to that?
Yeah, well, I just expand on that and say that addressing the spiritual aspect of this and what University Synagogue can do is very important, because it really challenges the role of organized religion when you can no longer gather as a congregation. You can't carry on your religious rituals. Like, I just imagine the kids who are supposed to be bar or bat mitzvah now and missing out on that very valuable experience, or just going to Sunday school and learning all those important lessons that we all, I guess, learned as children. And it saddens me to know that those experiences are being missed out on right now. So what can you do, you know, as a good Jew? And it just makes me think that perhaps tikkun olam and just doing what you can to help the world becomes the most important spiritual activity. And I think that also comes back to just doing the very, very simple things well, of keeping 6 feet away from other people and washing your hands. And that is not only something that's good for your health, that's good for the world, and impressing people with that.
I think giving people that message and that they are helping and healing the world by doing that is vital. I think forums like this, we're at 8:30, and I promised our guests that we would end at 8:30. They've had long days, but it's an ongoing conversation, and I want you to know that the leadership that we all have about how we can best support the community by trying to make phone calls and connecting and having forums like this. Some of you may have seen Cantor Shapiro ask a question about whether a future forum like this, particularly looking at communal resources, and would be valuable. It's tough because Judaism is about getting together and being a community and traveling this together. And we continue to explore the best ways we can do that while being safe and distance and keeping everyone healthy as well. So we will continue to have forums like this and continue to explore this and find different ways to connect together. I want to offer my gratitude to the four of you for coming in and really offering your wisdom and advice. And I hope we could do this again. Would people like to continue this conversation at a later?
Sure.
Yes.
Yeah.
Great. We would love to do that as well. I don't know if any of the four of you have any other last thoughts that you'd like to share before we sign off, and want to thank you all for all of your wisdom and advice and support. Yeah. I'll give the four of you the floor if any closing thoughts any of you have.
Just wash your hands. Stay home when you can. Wash your hands. You know, take good care of yourself. If you're having second thoughts about doing something, just skip doing it. It's good. We'll resume normal life. We don't know when, but we will.
Yeah. I think also that a lot of people say, oh, I'm just staying home, I'm not doing anything, but that's actually doing something. And people, you know, I think it feels very sort of disempowering. You're just sitting around and you're watching the world go by and you're seeing all these things, but you're doing something, even though it feels like you're doing nothing, by just doing that, staying home. And if you're questioning about doing something, and if you need to ask, should I play tennis? You know the answer. So don't.
And don't forget the best Jewish penicillin, even though this is a virus. Matzo ball soup.
There you go.
Thank you.
Thank you all so much.
Thank you all for being here tonight. And you all take care of yourself. I want to remind, by the way, speaking of all of that, we have services at 6:30 Friday night, and the theme is patience. So, not with a T, with that CE on the end. So come and join us.